Thank you, Speaker. I rise to speak in opposition to the Health Services Amendment Hospital Helipads Bill 2024, and I do so expressing deep concern, not just for the content of the bill, but for the precedent it seeks to establish. Legislation should be a tool of last resort, and it should not be a substitute for consultation, evidence, or planning. Yet what we have before us is a bill that proposes to mandate the inclusion of helipads in all new or redeveloped public hospitals with emergency departments, regardless of the clinical need, the location, or role in the broader health system. This bill was introduced with no consultation with the local health districts, no engagement with health infrastructure, no advice sought from New South Wales Ambulance, and no input from the clinicians who manage retrieval services every day. That's not lawmaking. That's legislating by media release. It's playing Russian roulette with people's lives. Speaker, I have some experience with this issue. The helipad at Nepean Hospital was closed in 2016. It was closed until 2021. That's 5 years. Not only had the helipad reached a point where it was no longer fit for purpose, but it also had the added complication of not being located in the best flight path position given the growth of our city around the hospital. This is a real living example of why helipads at hospitals need to be carefully planned by consultation with all the relevant authorities. This is critical when we're building this very important infrastructure. In the suburb of Kingswood, where Nepean Hospital is located, it's in a heavily populated area. The construction cranes from nearby residents back in 2016, from the residential developments back in 2016 were impeding the approach paths of helicopters aiming to land at Nepean. This closure caused helicopters transporting critically ill patients to be unable to land, leading patients to being transported by road and potentially delaying critical care. And often these patients then had to be rerouted down to Westmead. This was not in the best interests of our community. New South Wales Ambulance had to work with senior clinicians to develop a plan to ensure time-critical patients could be transported by road to Nepean. The result was, in emergency situations, helicopters had to land in a local park or in a sporting field and then use an ambulance to carry someone onto Nepean Hospital. But that was completely unacceptable. Our residents were put at significant risk. We need to learn from these real-life examples. Redevelopment of hospitals need to happen with the necessary due diligence. At a systems level, this bill is not just unhelpful. As I've just outlined, it could be potentially harmful. Speaker, the bill reaches far beyond Shellharbour. It forces every hospital redevelopment to include a helipad. This potentially creates several serious risks. First, it could delay the development of emergency departments altogether. If adding a helipad pushes a project over budget, then services may be scaled back or indeed shelved. That's not a theoretical risk. That's a direct result of imposing blanket requirements without context, without consultation, and without planning. Second, this bill could lead to the construction of helipads that are not operational. There is no mention of the ongoing costs required to maintain, staff, certify, and operate helipads to aviation safety standards. The bill mandates a capital asset, but is silent on recurrent funding or clinical integration. Third, as I've already mentioned, Speaker, it sets a dangerous precedent. There is no other piece of legislation in New South Wales that mandates the inclusion of a specific design feature in all health builds, regardless of expert planning. If we legislate helipads today, do we legislate the number of beds tomorrow? Do we legislate for a CT scanner in every hospital, even if there's no radiologist there to read the images? A bit like when you do a redevelopment and you don't plan to actually staff the building. However, the bill lacks clarity in some pretty critical ways. What constitutes nearby? What qualifies as a substantial redevelopment? How are costs borne or recouped? Hospitals are complex, interconnected pieces of infrastructure. They are designed by health planners, clinicians, architects and engineers working together, not by politicians looking to score points or a local media headline. The proper way to plan for helipads and every other component for a hospital is through established processes that take account of trauma roles, the local geography, safety, and the hospital's role within the health network. Speaker, where a helipad is clinically justified, it is built. We've seen them at my hospital at Nepean, at Wagga Wagga, Randwick, Westmead, and others. Where it's not required, we don't waste public funds building one just to meet a check box. Instead of paying for one helipad, we could modernise an entire resuscitation area in a busy ED, directly improving emergency care. Speaker, I don't even know how many critical emergency nurses it could fund just in 1 year in an emergency area. This bill is a shortcut to bad health policy, and I urge every member of this House who believes in evidence-based planning, who believes in common sense, fiscal responsibility, and a system of integrity for our health services to oppose this bill. And I do not commend this bill to the House and urge all members to vote against it.